Hi there, it's Marva Riley. So many people rely entirely on medications to carry them through their lives. So many people eat unhealthily, don't exercise, don't take the best care of themselves, but they rely on medications for high blood pressure. They rely on medications for blood sugar issues, medications for everything. But they never check the side effects of these drugs. And they all have some negative side effects. In fact, if you listen when they advertise these drugs on TV, they'll say, ask your doctor for such and such a drug, and they list a whole laundry list of side effects, of potential side effects. And I remember that when they used to go through these side effects really, really, really fast. But like my son was saying to me the other day, they're not even going through these side effects fast anymore. They're actually naming them one by one, really slowly. Oh, it could cause your kidneys to fail. It could cause your liver to fail. It could drive up your this. It could make you crazy. It could cause dementia, whatever. They're actually saying it. And then they go back to say to you, ask your doctor to prescribe such and such. Drugs are never the answer. They're never the first line treatment for chronic, especially chronic health issues like diabetes and high blood pressure and cholesterol issues and liver issues and kidney issues and whatever it is. Drugs should never be the first line treatment. Never. I can understand if you have pneumonia or something like that, you need it to be treated rapidly. But if one has diabetes and one has high cholesterol, for example, and one has high blood pressure, if one is willing to change their lifestyle and start eating differently, and losing that excess weight, a lot of these chronic health issues can be reversed or gotten rid of. Recently, a very good friend of mine had been having some major issues with their platelets. Their platelets would just get so low, like normal platelet is 150,000. And this family member, this friend, their platelet kept going down and kept going down all the time, would drop as low as 3. And they would wake up with globs of blood clots in their throat. And they would go to see these, blood doctors, and they do that test, and they would give them that, like steroids and all kinds of things. And the steroid is a Band-Aid. It was not the root cause of the problem. Finally, after like 2 years of this thing going back and forth, they went to see another physician. They switched physician to get another opinion. And the doctor said to them, it is these diabetes drugs that you're taking that are killing your platelet. It is these blood pressure drugs that you're taking that is killing your platelet. And I'm going to take you off all of it. Yeah. A lot of the issues that folks are having are related to all these drugs that we're taking. People are taking drugs for headaches. Sometimes they take drugs for headache, and the headache is as a result of dehydration, for example, not sleeping, stress. But we keep popping ibuprofen and Tylenol and Percocet and all those drugs for that headache. We have constipation because we don't eat enough fiber. We get constipated and we take laxative. We get heartburn, for example, because we eat too much or eat the wrong food, fried foods and things like that, or because we have too much weight along the tummy and we get reflux and heartburn, irritable bowel, gastric reflux, H. pylori from overweight and poor eating. And we keep popping Tums and Mylanta and those things which mess up our bones and cause so many negative side effects. When all we need to do is eat smaller portions and lose some weight and not go lay down with a full stomach, for example. Know what I mean? So drugs should really never be the first line treatment for chronic health issues. If you're constantly having gastric reflux and heartburn, why? If your blood pressure won't budge unless you take pills, ask yourself why. If your blood sugar is always high, why? Not because your mom and your dad have diabetes, that doesn't mean that you have to have diabetes. If your doctor says your kidney function isn't good, why? If your liver function isn't good, why? Ask a lot of why. Ask why. Why are all these things happening to me? And then you ask your physician, what can I do to reverse these issues? What can I do to change my lifestyle so that I can get off these drugs and live a healthy, drug-free life? I remember the days when I used to be on steroids, when I used to be on heart medicine, when I used to be on gastric reflux at purple pill, when the purple pill alone didn't work and they put me on Pepsid and all of that. I remember the days when I used to be on drugs for H. pylori. I used to be on drugs for joint pain. I used to be on so many drugs like an old lady. And not because you're an old lady doesn't mean that you have to be on drugs. My mom, I think, takes a half of like 2.5 milligrams of amlodipine. And I don't even think she needs to. Just feel that she needs to. That's it. So not because you're an old lady or an old man doesn't mean that you have to be on drugs. You just have to be willing to make some changes in your lifestyle. To eat healthier. To do some exercise. Get up and walk. Make sleep a priority. Decrease your stress levels. And drink water or herbal teas. And lower the amount of coffee that you're drinking. You see, if we're willing to make some simple lifestyle choices, a lot of the drugs that you're on, you can get off them. And they have so many negative side effects. Talk to your doctor about that, as opposed to talking to your doctor about getting on these drugs that these drug companies advertise on TV. Talk to your doctor about how can I get off these drugs and what lifestyle choices can I make? What lifestyle changes can I make, doctor, so that I can get off these drugs or not get on them at all? So I can be healthy, so I can lose the weight. You know what I mean? Your health is your responsibility, my friends. You've got to take charge of it and make some changes so that you can enjoy your best and your healthiest and your fittest life now. This is Marva Riley. Follow me for more health tips. And go ahead and order my health and wellness and weight loss books on Amazon and wherever books are sold. I am on YouTube, Instagram, Facebook, TikTok, LinkedIn, Twitter, always giving advice and suggestions as to how you can change your lifestyle to enjoy your healthiest life now, to become and remain the healthiest version of yourself. Go ahead and hit that subscribe button. Follow me so that whenever I post healthy tips, suggestions, whatever I post is always geared towards being the healthiest version of yourself. Now, if you hit the subscription button, you'll get notified every time I drop a video. Go ahead and subscribe today and share with your friends and your family. Your goal should be to become and remain the healthiest version of yourself, and my goal is to help you to accomplish that goal. All right? This is Marva Riley. Take care of yourself.